So on the morning that I was working in the IV pharmacy, we started about 7 o'clock, and during that time, it's the busiest time of day, and we had probably 15 to 20 batch labels to do, various types of drips that were needed. The phone was ringing off the hook for all of the electrolytes the patients needed to have replaced, the new levofed drips and epinephrine drips that everybody needed in terms of to keep their blood pressures up in the ICU. The nurse from the South 6 unit, which is where our chemotherapy is done, called and asked if they could get this intrathecal methotrexate order done because the patient wanted to go to interventional radiology to get this right away, which was a little overwhelming because usually we don't do that until later in the day, 10:30, when the morning rush is done. So we got the order, printed out the label, and I handed it over to our RV technician. I asked her to show me the preservative-free vial, methotrexate. She did. She went back and she compounded it and brought it back out. Unfortunately, the dose was 4 times normal dose instead of, we actually multiplied both the technician and I instead of divided. We packaged it appropriately like we normally do for chemotherapy, called the RN, and then our 8 o'clock technician came and ran the medication up to the floor. At that point, Jean, the RN who works in chemotherapy, called and said, this just doesn't look right. The label has 2 different volumes on it. One says 0.5, one says 2 mils. And I said, well, let's just redo it. That doesn't sound right. Let's just redo it. So we brought it back down. And at that point, I realized the error had occurred, that I'd actually multiplied, which would have been a lethal and fatal dose instead of divided. I reported immediately, and I know Jean as well had mentioned on the phone that she was going to report.
Event reporting is an indirect form of surveillance for unsafe conditions and safety hazards completed by the frontline staff. Safety events can occur in hospitals, but also outpatient care. The event can consist of anything from spills to unexpected death. They are usually broken down into 2 categories: events that reach the patient and events that do not reach the patient. Events that do not reach the patient are considered good catches. The action of reporting is as simple as completing an electronic form that describes when a patient is harmed or could have been harmed during outpatient or inpatient care. Knowing how patients could have been harmed or may have been harmed is the first step in preventing mistakes or injury and provides us with information for a proactive approach to safety. We encourage people to add their name and contact information when reporting an event. The information assists with the investigation by allowing us to contact the reporter should there be additional information needs. However, there is an option when reporting to remain anonymous. Our organization recognizes that decision-making behavior is often dependent on systems and processes in place to care for the patient. Mistakes and errors do not immediately equate to poor clinical judgment or incompetency.
Before we review how to report, it's important to know why we report. Event reporting supports HealthPartners' mission by promoting a safer environment for our members, patients, and community members. When we identify these situations, we facilitate an exchange of ideas and provide opportunities to explore the underlying factors and system dynamic that might enable us to prevent these events and reduce future risks. At Regents Hospital, we're committed to cultivating a culture that promotes learning and continuous improvement. Event reporting accelerates this process across our healthcare system. Other positive reasons include the promotion of transparency as well as encouraging a proactive approach to understanding error. Tracking these events can assist in trending and prioritizing changes in the way we deliver care. Finally, we report because it's the law. Hospitals are required to maintain a confidential event reporting system. Some events may be reported to the Minnesota Department of Health based on decisions at the legislative level so that healthcare organizations can learn from each other.
As residents, we have a unique perspective, and being on the front line of care, we often encounter events and circumstances that are either harmful to patient care or where we realize patient care could be greatly improved. Unfortunately, given our busy schedules and numerous demands, we often don't take the extra time to tell anyone about this. On top of that, when you rotate through many different departments in many different hospitals, you may not know who to contact about a certain event. Not only is event reporting something that will be expected from future employers, the ACGME expects residents to know where to report and how to report adverse events that occur during your residency. Fortunately for us, we already have access to event reporting via Epic. A simple click of the button at the top of your screen will bring you to an anonymous reporting screen. Did I mention this is an anonymous reporting system? Even though one is logged into the Epic electronic medical records system, reports contain no reporter identifying information, unless of course you choose to volunteer this information. If you would like to be identified, whether it's for follow-up or to provide additional details regarding the event, you have the option to do this within the report. The goals of this system are to improve patient care and learn from our past mistakes, not create an uncomfortable working environment or put additional pressure on residents. We would, however, like to see increased reporting of these events, which we know are occurring in our institutions. In order to see if online reporting via the EMR is an effective tool, we will be specifically asking residents who rotate through the HealthPartners system to participate in an anonymous survey every quarter to see if and how often they may be using the Good Catch event reporting system. Like reporting, the survey will be short and to the point. Our goal is to track numbers, not people. With your help, we can improve patient care and we can improve this complex system we work in.
Now that we understand the importance of reporting, let's talk about how to report. Choose which event category you feel fits the Good Catch you are reporting. Enter Regions Hospital as the facility in which the Good Catch occurred. To note, you can click on any box with 3 dots on the bottom to see the pick list of choices for that field. Enter the date the event occurred. Choose whether you want patient or non-patient. Patient should be chosen for inpatient outpatients. Non-patient should be chosen for family or visitors. Enter the patient's last name to choose the patient you want. Then click Look Up. It may take a few seconds for this patient list to load. Find the appropriate patient and click OK. All data fields that are bolded are required to be filled out before you can submit. All other data fields are helpful information for when the report is being reviewed. Enter the time for when the event occurred. If you choose to enter your name as a reporter, start by entering in your last name and click the button with 3 dots to speed up the search for your name. Or you can choose to remain anonymous by clicking the anonymous box. If you choose to enter your name, the only time this information is used is if a reviewer would like to connect with you if they have follow-up questions. Questions usually involve needing more details of the event or to understand how a similar event could be prevented. Enter the location. Start by typing RH, then click the Pick List box. Choose the location which best fits the area in which the event physically occurred. Finding the location gets easier the more you use the system. Entering the room number or further description of the location is very helpful. Enter the event type. Clicking the Pick List box speeds up this process. If you choose any other option, please type in a brief identifier for the event process that could be improved. Enter if the patient was injured. Click the drop-down box for the best answer at the time the report is being submitted. Indicate if an additional physician has been notified. If you have indicated an additional physician has been notified, enter their name. Again, the most efficient way to find their name is to start by typing the first few letters of their last name, then click the box with the 3 dots for the associated choices. Enter a brief description of the event and/or the processes for which there is a gap in patient safety. Then click Submit.
After a Good Catch report is submitted, it is reviewed by the manager of the location for which it was submitted. From there, a couple of different things could happen. If the report is regarding a high-risk process with potential patient injury, the manager refers the report to the patient safety department for a more in-depth review, possibly either a case review or a root cause analysis. Other reports are either investigated at the departmental level to determine appropriate next steps or are included in a unit's tracking and trending data to understand if it is a common occurrence. All reports are reviewed at a high level on a regular basis to identify trends occurring in multiple areas or departments across the hospital.
There were several things that happened. It was pretty remarkable. We had a root cause analysis, or an RCA, that was done where a group of the nurses involved, the pharmacists involved, which would be me, and my supervisors as well as the safety and quality group. We went through all the details of the event and sort of came to the conclusion that there were several processes that needed to be drastically improved, one of which was misleading labels that maybe in the time of chaos and busyness could have led to confusion on the volume. The other things that we had done were the whole process of chemotherapy from beginning to end, where we decided that we need multiple check systems to be implemented. So more like at least a 3-check system in the pharmacy, and then it would go upstairs to another 2-point check system. We implemented processes around intrathecal chemotherapy, which is a very, could potentially be a very deadly or fatal incident if this had occurred. So we made processes involved in where it would be stored in certain places. It would be only brought up by the physicians involved and administered by certain people and co-signed. So several incidents, which took, I think, about 6 months to implement across the board. So
I think one of the toughest things for providers is admitting mistakes. But we really want to emphasize that the focus is not on mistakes that have already been made, but on potential pitfalls. Those may indicate a gap in a process or a potential system failure. Those are things that it takes really everyone to keep their eyes out and to look for. Similar to the airport, they say, if you see something, say something. That's our motto as well. I think to whom much is given, much is expected, and we have a privilege of working for an organization whose mission is to improve the health and well-being of the population that we serve. As such, we have a duty to continue to look for ways to improve the way we deliver care, such that outcomes are improved, processes are more efficient, safety is enhanced, and affordability is kept in check.
It was about 40 years ago that a nurse made a huge difference in my thinking that has influenced the person I am today. I was an intern. It was late at night. The first patient that I saw had a pulmonary embolus, a blood clot to the lung. The treatment for that was a blood thinner, 5,000 units of heparin, followed by 1,000 units an hour. I finished working with that patient and went on to the next person who was young, perhaps 25 years old, person with diabetes who had a medical emergency, diabetic ketoacidosis. I knew that the treatment included not only fluids but insulin, and thinking insulin, I wrote 5,000 units of insulin followed by 1,000 units an hour. Now what I had done was, even though I was thinking insulin, I had used the dose of heparin. I ordered enough insulin on that person to kill an entire herd of woolly mammoths. Fortunately, I was working with a nurse who said, "Dr. Abelson, are you sure you want to give that amount of insulin?" I looked at what I had written and thought, oh my gosh, how could I have ever done that? I profusely thanked her and realized that that nurse had saved the patient's life. But in addition to saving that patient's life, that nurse had given me a gift, because here I am 40 years later remembering the near miss, yet I didn't hurt that patient. Imagine my life had I actually given that dose and had to live with that error. That nurse taught me that as colleagues, when we give each other feedback, when we speak up, at times have difficult conversations, we are not only doing the right thing, we are giving colleagues a gift.
We encourage you to identify and report opportunities for improvement. Good Catch event reporting helps support our mission to improve the health of our members, our patients, and the community by promoting continuous improvement in our healthcare system. Reporting good catches or patient harm can be anonymous and only takes a few minutes, but can have a tremendous impact on the safety of our patients.